Time to say very good morning to Mr. Jamie Jenkins. Jamie, how are you, man?
Yeah, good morning, Mike. Privileged to be on your last show before your new set.
Well, listen, it's not so much the last show. It's just that we're having this massive revamp. We're going to come back even bigger and better than before. And in the meantime, as you know, sometimes technology needs to be sorted. So that's what we're going to be doing. You can hear us all the way through on DAB and on all the usual apps that you listen to us on anyway. But, here we are again, Jamie, looking into a big bank holiday weekend. And everyone's saying in the medical business, it's going to be bad in the NHS. Why?
Yeah, well, let's run through the numbers again, Mike. So at the moment, the total number of deaths registered in England and Wales in the most recent week was below what we saw in 2015, 2016, 2017 and 2018. The number of patients in hospital, well, they have been rising with COVID, but you need to remember that 60% of patients in hospital with COVID are not primarily in for COVID. But ironically, since the last few days, since the NHS Confederation have put all this doom and gloom out, the admissions have started coming down as if the virus has said, okay, I'll go away. So I think let's take a step back. The NHS Confederation have been calling for further masks and further restrictions potentially on mixing up. But the chief exec there is a former advisor to Tony Blair. You do two and two and work out why he's coming out with that.
I'm calling for the NHS Confederation to be shut down. I'd like my money back because they don't do anything, as far as I can see, apart from slagging off the government and warning about things that they know nothing about. This is a guy who used to run the Royal Society for the Arts, right? He's a former apparatchik of Blair's, as you say, knows absolutely nothing, square root of, about medicine. Yeah,
and I think, Mike, a lot of people like the Confederation are jumping on COVID now to try and kind of get more and more money for the NHS. It's all we ever talk about is more and more money for the NHS. It's quite clear with the data, Mike. With the deaths data, this virus isn't as bad as what it was in the past. And they call in for restrictions on mixing as well, Mike. Easter, worried about Easter. Well, one of the things that we've got over the Easter holidays is the schools are closed. And when the schools are closed, that's a lot of in-house mixing stopped in a way because the schools are closed. So, I think, Mike, there's a lot of people still out there. I don't know why. I don't know if it's because they've got so used to putting out that fear, getting a lot of followers on Twitter because they're putting out facts and figures that scare the public, and they just can't let go, Mike. I think, you've been talking a lot of common sense. We've talked about it the last few years. Looking at the facts and figures at the moment, COVID is not what it was in the past. And people are saying we haven't got a plan to live with COVID, or we have got a plan to live with COVID. It's currently what we're doing. We are living with COVID.
But let's talk a bit about these numbers, because in Scotland we're told they've got the highest numbers of infections since the time immemorial, right? We're told there's more numbers going up. But surely the truth is different to that. It might well be that people are going into hospital and then being tested for COVID and either getting it there or being found to have it, but that's not the reason they've gone in.
Yeah, so overall, if you look at the ONS, there's a random survey of households which they do some tests so you can kind of identify roughly how many people in the population have got COVID. And they're at record levels across all four nations. They look like they've peaked, Mike. But I think the fact that we've got record number of infections in the country, but fewer deaths than what we've seen in the past kind of shows that, okay, this is a positive in a way, that we've got all these infections. I know in the last month or so, Mike, more people with COVID than at any point, but none of them have fallen really ill. It might be the demographic that my mum's got it at the moment, and she's not, seriously ill with COVID, right. And she's kind of coming up to a 70.
No, listen, I'm the same. People that I know have got it as well. It's a bit like when Omicron came around at Christmas time, and lots of people that I worked with, and lots of people that I knew suddenly had it, but none of them was sick.
Yeah, and well, on the hospital figures, Mike, so we have seen, again, those kind of newspapers who like to put that fear into the public, saying record numbers of patients in hospital. And we have seen in some parts of the country record number of patients in hospital with COVID. But since Omicron come on board, Mike, the number of patients in hospital, primarily because of COVID, has completely changed. Because remember now, we do test people as they go into hospital. And if more and more people in society have got it, imagine a world, Mike, where everybody tomorrow had COVID in the population. Well, everybody who goes into hospital would have COVID regardless of what they're going in for. So we're about 60% of patients in England of going into hospital with COVID, but not primarily because of it. And if you take the numbers out, looking at critical care, Mike, which is the real worry, obviously, in terms of the overwhelming the NHS. Since Omicron hit the country, the number of patients in critical care, primarily for COVID, has not moved. In fact, it's come down. So these are the numbers that don't get talked about. I put a graphic up yesterday on my Twitter feed, Mike, showing a breakdown of all the hospital beds. There are about 6.5% of beds have a patient with COVID in them, primarily for COVID, and 6.5% of beds are empty. So, when you start looking at the facts and figures underlying the headlines that are coming out, the NHS, if they're saying they're in a crisis, this isn't just a COVID-led crisis, Mike. This is basically the NHS is always in crisis, and people like to moan about it.
Well, the NHS, as I've found out over the last 3 weeks, is not just in a crisis. It is in long-term, I would say, decline. It's much worse now than it ever was in my memory. And I would say that almost every part of it is not functioning the way that it should. We started off talking about visiting hours to hospitals. We found out that up and down the country, and I don't know what it's like in Wales, but I suspect it's the same, more and more hospitals are still operating as if COVID is a deadly virus that you have to treat like Ebola. Only one visitor per hour, for 1 hour rather, per day, into a hospital. It has to be a named person, can't have 2 people, can't have 3 people, can't stay for 2 hours. I mean, it's madness. All the way through to GPs who still aren't seeing people, dentists who won't give you an appointment for 3 months. I mean, it's an absolute shambles. And one thing for sure is Easter holiday time, there won't be anybody working. Half of the people in the hospital will be off.
No, you're right, Mike. You don't want to be falling ill over the Easter holidays. That's bang on. And I've viewed the stories on your show about people who can't go and visit their loved one, or only one person could go, so somebody can't go the next day. This isn't living with COVID, Mike. And remember, when you see the record numbers of admissions that you see on the figures that people talk about 1 in 4 of those, and it's stayed pretty consistent for months now, Mike, but 1 in 4 of the patients they're going in as an admission on the figures, but they're already in hospital. But then they caught COVID in hospital, so they then get added as a COVID admission, even though they were already in hospital. Yeah. So, and that's about 1 in 4, and that's not stopped. So, over the course of the pandemic, I think things have really identified that the NHS, what is the National Health Service there to do? Is to treat sick patients, but they seem to get worried that people might get sick. And that's what the NHS is there for, Meg.
That was the other story we had, I think, earlier this week, which was from the head of emergency services in the NHS, a woman doctor who said that, the ambulance service is now so appalling that it's actually letting people down, not doing the job that it's meant to do, which is to protect the people most in need of help. Because you try calling for an ambulance now anywhere in Britain, and you're likely to be told either there isn't one or it's going to take about 5 hours.
No, I heard a tragic story, Mike. Thankfully, the patient survived on this. But an old guy in North Wales, he had to wait 12 hours for an ambulance, having fallen over and broken his hip. But all you kind of the ministers in Wales is about the free trees they're giving out to people to tackle climate change. Free trees, Mike, in Wales. If you want to pop over to Wales and you can have my free tree. I'm not getting one. I got plenty of trees.
Well, do you have a choice of which kind of tree you get?
Well, if I had a tree, Mike, I'd probably plant it somewhere where
where the sun don't shine. Yeah,
exactly. I shouldn't really talk about where we're going to plant it, but yeah.
Hang on a second. This is fascinating. So, what they're giving you? A seedling? Giving you an actual tree? What are they giving you?
Oh, it's like an actual tree, so you can go along. It's to tackle climate change in Wales, Mike. You know what the Welsh government are like. Everybody in Wales is allowed to have a free tree. They're starting to roll that out across the country. If I wanted one, I could go and get one, and it's just apps. And down the road,
paying for all these trees, though, it's the taxpayer, presumably.
Well, actually, where the money's coming from? If you remember, we were in the EU and we got all this money given to farmers to kind of the common agricultural policy is what it was, and in England and Wales, what they're trying to do now is rather than pay farmers to farm, they want to pay farmers to look after the environment now. That's kind of what they're trying to do. So so some of this money is about using the money that would go to farmers in the past and the budgets and that to deliver better environmental outcomes. And it's all about kind of the climate change nuts. And the thing is, Mike, I was crunched some numbers on this last week, actually, just slightly off the COVID topic, that in 1965, China emitted 5% of the CO2 emissions across the world. So it's 5% in 1965. 2020, it risen to 30%. And it's basically because they're using all the coal. And in 2020, Mike, China used more coal in 2020 than the UK has used since 1978. and they're continuing to use
Would you
more
mind
and more
passing
coal.
that information on to Extinction Rebellion, please, so they can move out of central London and head off to Shanghai, where they'll find themselves locked inside a building without any food?
Well, indeed, I put a tweet out about this yesterday, Mike, saying, why don't we all have a whip round and send them on a long, slow boat to China, and then they could all go over there, and if they're not locked down, they can go and glue themselves to all these coal stations in China.
Exactly.
And the reason that's important, though, Mike, is that part of the reason for that is that the Chinese economy has exploded over the last 30 years. Part of it is because, obviously, the Western world has outsourced loads and loads of manufacturing to China. But the net zero targets that the UK have got, if literally, Mike, if the UK tomorrow stopped all carbon emissions, got to net zero, you look at the figure then on the world chart, you wouldn't even notice it, Mike. It would make absolutely little difference whatsoever.
No. And also this tree planting rubbish. I mean, this is what Chris Martin did famously, the Coldplay guy, when he flew around the world on tour. Well, you can imagine, the amount of electricity used to power an actual live rock concert, 15 times a week or whatever it was. He plants a load of trees in Sri Lanka, right? Unfortunately for him, half of them died because it was too dry and there wasn't enough rain, and the others went on fire. Because it was so hot. So it's really not a very good thing for the environment in the end anyway.
No, it's just all this kind of virtual signalling, Mike. I think the cost of living crisis, you've been talking this morning on the show about Boris, and people saying, the moment people want Boris to resign. The poll that came out on that, Mike, I think it was like 57%.
That was another YouGov poll, wasn't it?
Yeah, another YouGov poll. But remember, this is a random survey of people. Well, I would imagine if before the pandemic, 57% of people would want the Prime Minister to resign because they don't support the Conservative Party. So I don't think it's telling us a lot. The thing that's really kind of wound me up a bit more on this Partygate scandal, Mike, is that they're all saying Boris resigned for this, but, the vaccine passes that were imposed, school closures, all those care workers that were sacked. And that's in part, Mike, why the NHS is in a bit of a crisis, because you've got loads of patients in hospital, cannot be discharged because we haven't got enough care in the community. Yeah. Sacked all those care workers, all the campaign fear. All people seem to be fine with that. But Boris has a bit of cake in Downing Street. They want him to resign. It's just, have they got short memories, Mike?
Well, I think it tells you that they're politically motivated. It's not about whether he's a good Prime Minister or not, or whether he's done the things that he said he would do. It's about something they think proves him to be some kind of a liar, and that's why they want to go for him. But it's all, to me, it's all just, wind and nonsense at the end of the day. Because what if you were really going to be saying, sort the world out, sort the country out, do the things we elected you to do, and all of those things I've mentioned, and fix the energy crisis, make energy cheaper, stop the immigrants coming here illegally, and make sure that people can actually afford to heat their homes without this kind of madness drive for net zero.
Well, remember that term levelling up, Mike? I don't think we understood what it means, but that seems to have kind of vanished. And you're right, I think a lot of this is politically motivated. Mark Drakeford put a tweet out yesterday with him saying that those who make the laws shouldn't break the laws and he should stand down. Another thing recently in Wales, Mike, the health minister was banned from driving for speeding, obviously several times, totting up enough points, so banned from driving. So this is the health minister. And in Wales, Mike, I don't know, I don't see so much of it in England, because I was driving up to Chester about 6 to 7 months ago. And there's a road that goes from Wales, from Wrexham up to Chester, which is kind of a nice dual carriageway. When you're in the Welsh
I know.
side,
is that the A50?
I think A4, A3, I think it might be, Mike. But it's a road, basically. So when you're in the Welsh part, there's a 50-mile-an-hour speed limit because they want to reduce the emissions to save the planet.
Right.
When you get to the England part, you can go back up to 70 miles an hour again. So the health minister's reducing all these speed limits across the country to save the planet, stop emissions as well, so people got healthier air to breathe in. And then she's breaking the law. No mention of Mark Drakeford on her resigning because she's broken the law there, So double standards as well, Mike.
Absolutely right. And as far as the actual COVID figures go, just to sort of, to cap that off, the increase in COVID figures that people say we are seeing, which may potentially overwhelm the NHS, they're not really giving any context to that properly, are they?
No, and that's the context that's missing. So, record numbers of infections across the country, but the total number of people dying is, to say, lower than what we saw in many of the years pre-pandemic. The total number of patients in critical care, when you look specifically at the figures, Mike, which are those in hospital primarily because COVID's making them seriously ill, that has come down since the Omicron variant. And the number of patients in hospital because of with COVID, but not because of it since Omicron's hit, has been going up and up and up. But that's the context that seems to be lacking from a lot of these newspaper reports or journalists who are trying to scare the public again on all of this. Yeah,
exactly right. Well, there is unfortunately still this rump of people who seem to think that wearing masks is a good idea. I heard somebody the other day talking on another radio station saying, I think it's time we brought masks back. It's not such a big deal. What's the big deal about wearing a mask? It'll keep everybody safer. And you go, well, one, it won't keep everybody safer. Two, it doesn't work. Just look at Scotland. Three, actually, people don't want to wear them. There's hardly anybody wearing masks around these parts anymore. I don't know what it's like where you are. People don't like it. And as it gets hotter, they'll like it even less.
No, indeed. And Mike, up until the most recent weeks, Scotland had higher infection rates than England and Wales.
Yeah.
England and Wales had got rid of them. Scotland had kept them in some settings. I'll tell you an interesting thing with these lockdowns, Mike, is Shanghai what they've done is they've extended the lockdowns, and these are proper, really stringent lockdowns where you get arrested.
Yeah, people haven't got any food.
Yeah, and the reason they've extended the lockdown, Mike, is because the lockdown hasn't worked to stop infections going up. So it's like, why are you extending something that's not working? Because it hasn't solved the problem.
Right.
China are just in cloud cuckoo land.
Well, you clearly can't operate as a normal human being, going out and about, going to work, going to the shops, meeting people, without the risk of getting COVID, because COVID is out there. Simple as that. Just deal with it.
Indeed, and that's part of the living with COVID thing, Mike. People have. My child's had COVID twice, but both times he was off school only because he couldn't go to school, Mike. But he was playing football in the garden. Yeah. And as soon as he found out he had it, he was jumping for joy with this and stuff. And that's why living with COVID, people are going to catch COVID. Yeah, the fact is that for the vast majority of people now, as we just discussed, it's a small, minor illness for them now. Not what it was 2 years ago, which is thankfully, where it's moved on. And new variants will come on. People are already scaring us about a new deadly variant will probably happen at some point. No evidence for that. All it is this campaign of fear that keeps...
And guess what? And the thing that really disturbs me is that the people mostly running the campaign of fear are all working in the NHS.
Indeed, Mike. It's either working in the NHS or kind of labour activists. That's what I tend to find on Twitter, that they are basically people, who really want restrictions. They want to control people's lives and just using whatever mechanism possible to do that. Thankfully, I think one of the positives of Partygate, Mike, is it kind of weakened Boris's power within the Conservative Party. So the backbenchers kind of, rather than get all those letters in to get rid of him, it kind of meant that he had to get rid of things like vaccine passes. He had to bring forward the removal of all the restrictions. So one of the positives of Partygate for the public as a whole is kind of opening the eyes to Boris to say, I need to roll back on some of these restrictions.
No, it's amazing how safe it got to travel when that story came out, wasn't it? Remarkable. But there we are. Jamie, good to see you. Thank you very much indeed. We'll talk again soon. Jamie Jenkins, former head of health analysis at the ONS.